finished with the digestive system guidelines, and now whenever you are approaching the CPC exam, the only way to clear that exam is to do a lot of questions, because that will help you to strengthen your guideline, to see the important wordings and how to read the code and how to read the parenthetical notes and how to apply them. So I have taken the three parts, in that every part pretty much will include the 20 questions, and that will help you to practice more. So we have read the question, and now we will try and solve this question. What has happened here is the enterectomy. Enterectomy is the removal of the intestine, the small intestine, which is called as a that is called as the enterectomy. And in this case, what has happened is they have done the four distinct resections were performed with the corresponding anastomosis. So let us look at the options. So 44120, it is talking about the enterectomy, resection of the small intestine, but a single resection. And in our case, it is a four distinct resection. And this particular code 44120, it has the add-on code, and it talks about each additional resection. And there is a guideline which says use 44121 in conjunction with 44120. So the code 44120 into 4 is not correct, because there is an add-on code. We need to use that code. And 44120 and 44121 into 3 is the correct answer, because we have a 4 distinct resection. The first is we will cover by 44120, and since they have used the word each additional, we will use the 3 units of 44121 to complete our encounter. So try and read this question, and try and solve the question on your own, and in the next slide we will try and decipher the answer. So let us collect our data. In this case, what has happened is the patient present with a port site of pain and malfunction of the adjustable gastric band system. And it is determined that the component of the gastric restrictive device needs to be removed and replaced, and the procedure is performed under laparoscope. So they are going to take out the gastric band system, they are going to replace it, and this procedure is carried out under the laparoscope. And if you see all the code, 43772 talks about only the removal of the gastric restrictive device. But in our case, it was removed and replaced. So 43773 is the most appropriate code. And here they have given the parenthetical note that do not report 43773 in conjunction with 43772. So that will eliminate the option B. And 43888 is the removal and replacement of the subcutaneous port. So the system itself is very different. So by looking at all the options, 43773 is the correct answer. So what they have asked in this question is where is the splenic flexure? And if you see that this is the area of the splenic flexure and it is in between the transverse and then the descending column. Okay, so the option C is the correct answer. So pay attention to all the words and what they have asked, because if it is a hepatic flexure it comes here, but the question was splenic flexure. So let us collect our data, and there is a lot of data here. What has happened is this patient had a history of carcinoma of the sigmoid colon, and for the he came for the diagnostic colorectal cancer screening. So it is a history of the carcinoma. That means that carcinoma was taken care of, and he came for the screening. The patient completed the treatment for the cancer in 2004. The physician performed the diagnostic flexible sigmoidoscopy exam to screen for the recurrent colon cancer and examine the anatomic side. And during the exam, they found the 3 polyps in the rectosigmoid junction, and they were removed by the hot biopsy forceps. Now we need to check the codes. So 45333, it is the code for the removal of the tumor or the polyp or the other lesion by the hot biopsy forceps. And then we have the ICD code also. So what happened is, though it is a diagnostic colorectal screening, it was converted into the surgical, because while doing that, they found 3 polyps. They removed the polyps with the hot biopsy forceps, and they were the 3 polyps. Now remember that 45331 is with a biopsy single or multiple. 45338 is with removal of the tumor or the polyp other lesion by the snare technique. Here they have used the hot biopsy forceps. So we will go with the code 45333, which is the removal of the tumor and the polyp with the hot biopsy forceps. And uh, we will look at the code Z08, that is indicate the encounter for the follow-up examination after the complete treatment of the malignant neoplasm, and that was happened for this patient. Z85.038 is the personal history of the other malignant neoplasm of the large intestine, that is also there. And D12.7 is basically the unspecified polyp, the benign polyp, because here it is the path report indicates that the polyps were benign. So we will pick up the code 45333. Let us take the next question. Try and read the question and try and solve it on your own. Now let us find out what has happened in this case. Now the patient had a rectal bleeding and he underwent a proctosigmoidoscopy. And during the proctosigmoidoscopy, the physician identifies the internal hemorrhoids. The proctoscope was withdrawn and the anus was prepped, draped, and endoscope was inserted. There was a prolapsing hemorrhoids in the anterior midline and the rubber band ligation was applied. So in this case, two things happened. There was a diagnostic proctosigmoidoscopy that has happened, and then they have removed the internal hemorrhoid with the help of rubber band ligation. So we will have to code both the things. Remember, here the two things happen. Diagnostic proctosigmoidoscopy happened, as well as the hemorrhoidectomy also happened. That is the removal of the hemorrhoid. Which hemorrhoid? Internal. How did it? How did they remove it? By the rubber band ligation. And that's why we are going to write 46221. That will be our first code. Always remember, whenever we are writing the 2 CPT code, it is the the code which has the higher money, that code will go first, followed by the proctosigmoidoscopy. Though the proctosigmoidoscopy happened first, while writing the code, we always write the code which has the maximum money weightage. And then we will put the modifier 51 because these two procedures happened during the same session. Okay. Let us take the next question and try and get the data point from this question, solve the question, and then we'll decipher. So let us understand what has happened here. So in this case, the colon was well prepped, the instrument was slowly withdrawn, and what they have done is they have removed two polyps. One was 3 millimeter polyp and in the proximal ascending colon, and the polyp was removed with the hot biopsy forceps. And there was one more polyp which was in the rectal area, and that is also removed by the hot biopsy forceps. And there was also moderate diverticulosis extending from the hepatic flexure to the distal sigmoid colon. So what has happened is they have removed two polyps with the help of hot biopsy forceps. So we had to code only for that. There was a moderate diverticulosis which was there, but no any treatment was done towards that, at least in this session. So we'll be coding for the two polyps which are removed with the hot biopsy forceps. Now, if you see the code 45384, this is a pretty much common code for the three option, and in that the one option says do not report 45384 in conjunction with 45378. So we cannot take the option B. 45384 is the option for the removal of the tumor of the polyps, other lesion, with the hot biopsy forceps. And then if you see the code 45380, so the 45380, it is the code for uh, the colonoscopy flexible with the biopsy single or multiple, uh, and 45382, it is basically with the controlled bleeding. So the controlled bleeding didn't happen. So D is not the correct answer, C is not, B we have a parenthetical note, and so A is the correct answer. Let us take one more question. Always try and take the important bullet points which are required for our coding. So let us decipher the data that we have. It is a 50-year-old male, and he has uncontrolled diabetes and hypertension, and the non-operative way of controlling his obesity has failed, and then that's why they have taken the decision to perform the gastric banding. This gastric banding is done under the laparoscope, because, and you can see the word 4 or to 6 trocar ports are sited through the interior abdominal wall. The silicone gastric band is placed and secure around the upper stomach to form the smaller stomach pouch with a narrowed outlet, and tubing is attached to the band and tunnel through the abdominal wall, connecting it to the access port. So let us look at all the code. So if you see the code 4384, 43634, what is that code? And 43645. So begin with the 436634. It is the code for the formation of the intestinal pouch, gastrectomy, partial or distal, with the formation of the intestinal pouch. And here what they have done is smaller, to form a stomach pouch, not intestinal. Then 43645, if you see that code, it is for the with a gastric bypass and small intestine reconstruction to limit the absorption. So there was no gastric bypass. What they have trying to do is they put the gastric band in order to reduce the the opening of the stomach, to make the outlet narrow. And 43770 is a laparoscopic surgical gastric restrictive procedure, placement of the adjustable gastric restrictive device. And that's what pretty much happened. So we will go with the answer 43770. Next question, pretty straightforward question. So the question is rigid proctosigmoidoscopy, removal of two polyps by the snare technique. Very easy question, and we have 45320. It is removal of the polyp is by the method ablation. That is, we use the extreme heat to burn the thing. Then 45309, it is with the removal of the single tumor polyp or the other lesion. And we have 315, it is for with the removal of the multiple tumor polyps or the other lesion with a hot biopsy forceps, bipolar cautery or a snare technique. Now remember, this is a very interesting code because this talks about the multiple polyps, and it include any method of removing the polyp, because the hot biopsy also I'll use the same, snare also I will use the same. So kindly put a asterisk in front of this code. And this is the indented code. So if you see the language, it is a rigid proctosigmoidoscopy with removal of the multiple polyps. So remember that. So I have included some medical terminology question also that are related to the topic. So yes, D is the correct answer, because what they have asked is the term for surgical procedure that creates the opening. Opening is a stoma, and where they are opening is into jejunum. So jejunostomy is the opening of the surgical opening into the jejunum. Colostomy is the surgical opening in the colon. Gastrojejunostomy is the opening at the junction of the stomach and the jejunum. And the gastroenterostomy is between the stomach and the intestine. Okay. So this is an important question. I hope you remember the guidelines of the tonsillectomy and adenidectomy. So read it and then give me the answer. Now here what has happened is the patient patient tonsils were swollen and he is having the recurrent tonsillitis, and doctor decided to remove the tonsil. But during the same operation they have seen the adenoids are also significantly inflamed and they decided that they must be removed. So actually what happened is there was a tonsillectomy and adenidectomy. And if you see the code, we have a separate code for the tonsillectomy, separate code for the adenidectomy, and there is a one combo code, and this is 42820, tonsillectomy and adenidectomy. And remember, whenever we are coding for the tonsillectomy and adenidectomy, age is an important criteria. And here, younger than 12 years, our patient age is 8 years. So 42820 is the correct answer. So always whenever you are solving any question, quickly look at the options, and if it's possible, try and remember the guideline because that will help. So here in this question, what has happened is the patient had a symptomatic internal hemorrhoid and the patient decided to go for the surgery, and the doctor has removed the internal hemorrhoids or acted upon the internal hemorrhoid by applying the rubber band ligation. So here when you see the codes are depend on which hemorrhoids has been treated and how did we treat that hemorrhoids. And if you see all the code, pay attention whether it is internal or external and whether you are using the rubber band ligation or whether you are not using the rubber band ligation. So when we see all the code 46221, it talks about hemorrhoidectomy internal by rubber band ligation, because 46945 it talks about the internal by ligation but other than the rubber band. And if you see the code 250 and 255, they talks about the external hemorrhoidectomy, and one talk about the external as well as internal, but in our patient only the internal happened. So the only way to pass the CPC exam is practice, practice, practice. Now let us look at what happened in this patient. The patient underwent a hernioplasty and to the recurrent ventral hernia, which was incarcerated, and the defect size was 2.7. So whenever we are dealing with the question of the hernia, we look for the type of the hernia, then the clinical presentation. So the type is recurrent, clinical presentation is incarcerated, and the wound defect size is 2.7 centimeter. And the mesh application, now in this case the application of the mesh is the part of the code, so we don't code it separately. But remember, if the debridement has happened, we code the debridement separately, so we will have to code the debridement separately. So 49614, it is the code for the incarcerated ventral hernia, which is of the recurrent type, and the defect size is less than 3 centimeters. So we will require this code, and this is the code for the debridement. And since that has happened in the same sitting, we will have to put the modifier 51. Practice makes man's perfect. So let us look at this case. What has happened here is there is a 82-year-old female, and she had a proximal small bowel obstruction. She was taken into the operating room, and elliptical abdominal incision was made. So in that case, we know that this is a open procedure, not the laparoscope. There were extensive adhesion along the entire length of the small bowel, and the omentum and the bowel were stuck up to the interior abdominal wall. Time consuming tedious lysis. That means we will require the modified 22. Okay, because anything which is time consuming and it takes more time than is required, we will use the modified 22. That eliminates our option A and option D. And in between 44180 and 44005, let us look at the code. 180 is the code for the laparoscopy, but we have used the abdominal incision, so we cannot take the code, and we will zero down the code 44005 with the modified 22. So let us look at our data. So in this case, what has happened is Veronica had a left upper quadrant pain, but then when they took the ultrasound, they didn't find anything because they have mentioned it is a negative ultrasound. So they explained the need of the diagnostic surgical procedure to determine the cause of the pain, and the patient agreed. And then they did the diagnostic duodenal, they put the diagnostic duodenal intubation and tried to aspirate the content. And after that, the physician decided to reposition the tube under fluoroscopy guidance and obtained multiple duodenal fluid specimen during the same operative session. Now, if we look at the code 43757, it is talking about a collection of the multiple fractional specimen with the pancreatic or gallbladder stimulation, single or double lumen, including the drug administration. So, and 43756 is it is talking about the single specimen. We have taken the multiple duodenal fluid specimen. So, B is not the correct answer. 43755, it is also the collection of the multiple fractional specimen, but with a gastric stimulation. Gastric stimulation didn't happen in this case, so we cannot take the code. And D is not the correct answer because this is not the way we will write the answer. Even the modifier is not correctly put up for this particular case. And when we have a multiple duodenal fluid specimen as an option, we will go for the multiple, not first single and then the multiple. So let us look at our question. What is it? This is the operative report, and important thing is we get the operative report for the exam. Pre-operative diagnosis is lesion buccal mucosa. Post-operative is also same procedure, is excision of the lesion. That is very important, of the buccal submucosa. And now we need to quickly go through the procedure, because many a time the procedure will give us a lot of clues. And in this case, there is a lesion excision happened, and the lesion does not extend into the muscle layer, and they have the complex mattress suture, that is a complex repair that has happened. Now let us look at the code. Now if you see the code 40816 and 40814. So the 40814, it talks about the excision of the lesion followed by the complex repair. And if you see the code 40816, it talks about the complex with the excision of the underlying muscle. But we have seen here that the lesion does not extend into the muscle layer. So we did not excise the muscle layer, and that's why the 40816 is not the correct answer. And 40814 is the correct answer, and K13.70 is the correct code because it is the submucosal lesion, but it is not a they haven't specified what lesion. So unspecified submucosal lesion, and K13.70 talks about that. And if you see the code 40831, it is talking about the repair. But there is no need to write this code separately, because 40814, that code language includes the complex repair. So let us look at our case. In this case, what has happened is the patient had the paraesophageal hernia, which was reported by the laparoscopic repair with a fundoplasty and implantation of the mesh. And during the procedure, the laparoscopic esophageal lengthening was completed. Which codes capture this procedure? So if you see the code 43327, this talks about the lapro open procedure, and even 43333 also talks about the open procedure. And in our case, they have very clearly mentioned the word laparoscopic repair, so we cannot take A and B. Then if you see the code 43281, it talks about the laparoscopic surgical repair of the paraesophageal hernia, but it is without the mesh. In our case, we have put the mesh, so we will require a code 43282. And so this is also not the correct answer. And just take 43283, it is a laparoscopic surgical esophageal lengthening. So that is an additional procedure, remember. And we will have to code, and here they have given the add-on code. And here also there is a note that you can use this code in conjunction with which are the code. So the parenthetical note is very important. It will always help you to select the correct option. So let us look at our case. The patient underwent an EGD with a transendoscopic ultrasound guided transmural fine needle aspiration biopsy. And let us look at the code. So we have the code 43242. And in this case, it is a with a transendoscopic ultrasound guided intramural uh, transmural fine needle aspiration biopsy, includes the endoscopic ultrasound examination. Now, it includes the examination, so there is no need to write the separate code for the separate image guidance code. So A is not the correct answer. And if you see the 43235, the 43235 code, it talks about the uh, esophagogastroduodenoscopy flexible transoral, including the collection of the specimen by brushing or the washing when performed. And 242 talks about the fine needle, and in our case it is a fine needle, so we will go with the answer 43242. And here also very important note, do not report 43242. So answer D is also wrong, because here it is given. We cannot write 43242 along with 43235. Okay, remember that. So always the parenthetical note helps you to zero down many wrong answers. Whenever there is a modifier in the question, pay attention to those things. So many a time the the modifier gives you important clue. Now in this case, the 22-year-old patient was scheduled for a repair of a incarcerated bilateral recurrent inguinal hernia. The patient was taken into the OR. The anesthesiologist administered the GA and indicated the patient was ready for the surgery. The surgeon created the incision, but the patient went into the shock due to the surgery and the procedure was halted. So that is important clue for you, and which modifier you will use it, 53. And 49521 is the code for the the repair of the incarcerated bilateral hernia. And this C is not the correct code, because it is only it is talking about the anesthesia given by the anesthetist, and the 51 modifier we don't require a 51, we require a 53. And this is also the code along with the 47 modifier. That means the anesthesia was given by the surgeon. That was not the case. So many a time the modifier will help you to zero down the correct. So let us look at the case. The 3-year-old swallowed the marble, and that's why doctor did the esophagotomy. That is, cut open the esophagus, and the approach they used is a thoracic approach, and they removed the foreign body. So if we take all this important data point, we can zero down the code esophagotomy thoracic approach with the removal of the foreign body. Pretty straightforward question. This is the last question from this set. Pay attention to important data points. And so what has happened here is there is a diagnostic colonoscopy. However, patient was fully prepped, and an object then shifted into the descending colon just below the splenic flexure. The physician was unable to advance the scope beyond the splenic flexure. How would you report the diagnostic colonoscopy? You can either use the colonoscopy deciding tree, or there is a very important guideline here that if the physician is unable to advance the colonoscope to the cecum or colon, small intestine anastomosis due to unforeseen circumstances, report 45378. And if it is 44388, if it is through the stoma, and with the modifier 53, and provide appropriate documentation. This is a very important, the guideline which we are using here in order to zero down our code.